The title of my presentation is Diabetes, a Menace, Self-Care Management as a Solution to Diabetes Complications. Presented by Adigun, Christy. Diabetes is a menace. It's a threat to the whole world. And the International Diabetes Federation call it a growing epidemic. Diabetes indeed is on an increase, and a wide number of patients are having complications. The aim of this research, therefore, is to find out why the increase in diabetes and its complications, and also to ascertain the level of awareness of diabetic patients and their attitude to the practice of self-care management. The researcher believed that a lot of patients with possible preventable and controllable diabetes complications are having their life put to risk by poor knowledge of diabetic complications, by poor knowledge of self-care management. Therefore, he uses questionnaire with a sample size of 110 to confirm this hypothesis. Many other studies, the results show that there is poor attitude to diabetes self-care management, and also poor control of blood glucose level. Many researchers confirm so too, and they asserted that those with adequate knowledge of diabetes self-care management have a better control of blood glucose level, and so prevent complications. So what? Diabetes is a chronic metabolic disease that is being characterized by raised blood glucose level that causes problems to the eyes, to the kidney, to the nerves, and to the blood vessel. And if poorly managed, leads to poor health and many complications. Raising awareness, therefore, on diabetic self-care management could be a solution to this problem. The activities of self-care management include healthy eating, taking balanced diet, low carbohydrate, and low blood glucose level, being physically active, monitoring of blood glucose level, BP, cholesterol level, and also the weight, being compliant and adherent to medication, good problem-solving skills, healthy coping skills, and risk reduction behaviors. If these things are being done, it will prevent macro and micro complications of diabetes like stroke, heart disease, peripheral vascular diseases, foot problem, retinopathy and cataract, and also renal diseases and nephropathy will be prevented. It will also help patients in maintaining normal glycemic control and have good blood BP. It will prevent hypo and hyperglycemia. It will improve patient life, bring about normal weight, and then reduce morbidity and mortality rate. It is also It is cost effective, brings joy and relief to the patient when there's no complication. Despite the above mentioned usefulness of a self-care management, its practice is still found to be very low among diabetic patients. Diabetes, according to diabetes is on increase, as I've said, worldwide. More than 435 million people worldwide are having diabetes. And this shows a quite number of people that are having diabetes. In Nigeria, over 5 million people are diabetic. And in the center where I'm carrying out these studies, 120 patients are seen on an average basis every month with diabetes. The respondents, 22% of them had their limbs amputated due to diabetes. The increased prevalence or comorbidity and multiple complications of diabetes places a substantial global burden on economic challenges of individuals, societies, and the world as a whole. Thus, this prompted this study, and also to ascertain the level of awareness.
Yeah, you got another 3 more minutes. You got another 3 more minutes to complete.
Hello.
Yeah, you got another 3 more minutes to complete.
Hello. Hello. Okay. The method used in this study was a questionnaire survey. The study was carried out in Federal Medical Center, Yola, a tertiary institution in Adamawa, Nigeria. Variables used were social demographic data, the awareness, knowledge, and attitude, with also the barriers. Population, okay, the sample size is 110 respondents. The doctors and the nurses were used in helped in collecting the information, especially those who could not read and write. Analysis was done using SPSS Windows 16 to determine the frequency and the percentile, and the result was presented in graphical form. Ethical clearance was done, and oral consent collected from patients before this. The result shows that a quite number of patients are in the age group of 40 to 60, and 50% of them have type 2 diabetes. Only 30% have a normal blood glucose level of 3.5 to 6.1 millimole. A lot of barriers were reported, among which were finance, poor access to drug, and number of people with diabetes problem. A lot of them have eye problem. A lot of them have their leg amputated. 22%. They have seizure problem. In conclusion, therefore, and the knowledge level, according to knowledge level, 48% of them acknowledge that they are aware of self-care management, but 32 have poor knowledge. Attitude to practice, 61% of them have poor attitude to practice. In conclusion, therefore, the researcher concluded that there is negative attitude to self-care management, that there is half-baked knowledge and poverty of understanding by the respondents.
Adigun, Christy? Hello.
That there's lack
Hello.
of teamwork on
Your time is up. Yeah, your time is up.
Hello, ma'am. Hello.